I'm Ria and welcome to Narikaa Talk Show. Let's learn together and grow. And today it is a moment of extreme pleasure to welcome a very acclaimed doctor, Dr. Siddesh Iyer, who is present here with us, and he will be answering some of our questions regarding today's topic, which is tubectomy. I know there must be many queries regarding this session. So before jumping to the questions directly, doctor, please tell our viewers something about yourself.
At the outset, I'd like to thank Narikaa for giving me this opportunity. I am Dr. Siddesh Iyer. I'm an obstetrician, gynecologist and a laparoscopic surgeon. I practice in Borivali, which is a northern suburb of Mumbai, and I deal with high-risk obstetric cases, and my special interest is vaginal surgeries. And tubectomy is something that has been part of our journey right from residency days through practice. So it is something that I would love to talk upon. And thank you, Narikaa, for this opportunity.
Thank you, doctor. And doctor, at what moment would you say was the moment when you decided to become a doctor?
Well, tough question. Honestly, there wasn't any specific light bulb moment where I decided, yes, I have to become a doctor. I think God just paved the way, things kept moving on, and I became a doctor by chance, I would say. But yes, there was this empathy that was always there, which made me feel for the ones who were in pain and the ones who were in need of help. And that probably paved the way forward. So that's how I landed up in this profession. And I'm happy to be here.
Thank you, doctor. So as the topic itself says, tubectomy. So our very first question for this session is, doctor, what is tubectomy?
Well, tubectomy is female sterilization. It is a procedure where a part of the tube as in the fallopian tube. Fallopian tube is a part which is attached to the uterus, and the main function of the fallopian tube is to carry the egg from the ovary to the uterus. So tubectomy is a procedure where this tube is cut or tube is burnt. So this is basically what tubectomy is.
And doctor, what are the indications of tubectomy?
Indications of tubectomy would first and foremost be some woman who has decided, yes, I don't want to get pregnant anymore. So I've completed my family and I want permanent sterilization. That is, I do not want to have any more children. So this is the major, probably the only indication for a tubectomy.
Doctor, what is the purpose of tubectomy?
As I said earlier, tubectomy purpose is to ensure that a female can regulate her fertility, and she decides, or the family or the couple decide that they do not want to have any more children. So they go ahead with this surgery, which is known as tubectomy or female sterilization.
Doctor, how effective is tubectomy?
The effectiveness of tubectomy is calculated in terms of failure rate actually. So the failure rate of tubectomy is less than 1 in 100. So quite an effective procedure actually.
And doctor, what is the procedure of tubectomy?
Tubectomy can be carried out through a number of ways. It can be carried out through open surgery. It can be carried out through a keyhole or a laparoscopic surgery. So an open surgery is generally done through a small cut only on the tummy. This is called a mini-lap surgery. It is a surgery which is done under anesthesia. Both open and laparoscopy are done under anesthesia. And after the anesthesia sets in, a small cut is taken on the tummy and a particular part of the tube is either cut or burnt. So this is the major gist of a tubectomy procedure.
And doctor, how long does it take for tubectomy to work?
Well, tubectomy is effective right from the word go itself. So the moment a tubectomy is done, the woman loses her ability to have children anymore. So what it effectively does is it prevents the egg from reaching the uterus, and so tubectomy is effective immediately.
And doctor, are tubectomy and vasectomy the same technique?
Well, conceptually they are the same. I mean, they are not the same procedure per se, but then it is something that blocks the gamete from reaching its right spot. So tubectomy is something where the tube or the fallopian tube is cut, and a vasectomy is where the vas deferens or the tube which carries the sperm from the testis to the exterior is cut. So they are different procedures, but by and large when you talk about the concept, they are preventing the gamete from reaching their specific locations. So this is the basic difference in the two.
And doctor, what is the best time to have a tubectomy done?
To have a tubectomy, the government of India has set up certain guidelines. So tubectomy can be done 1 after a period, 2 after a delivery, 3 after an abortion. So basically, when one is considering to have a tubectomy, within the first 7 days of the period is something that is called as an interval tubectomy. Immediately after delivery is called as a puerperial tubectomy, and it could be done post surgical MTP or post abortion also. So these are the specific times when a tubectomy can be done.
And doctor, who is not eligible for tubectomy treatment?
As the guidelines that I mentioned before speak about this as well, any woman who is less than 22 years of age or who is more than 49 years of age is not eligible to undergo tubectomy. Similarly, the guidelines mention that the woman has to be married and she should have at least one child over 1 year of age. So if she does not fit into the criteria, then she is not eligible for a tubectomy. Apart from that, there are certain relative contraindications. That is, if her hemoglobin is very low, or she is suffering from some major disease, or there is some heart disease which is preventing her to undergo tubectomy right now, then these are the women who may not be offered a tubectomy. Honestly, there is no woman who cannot undergo a surgery per se. It is that who undergoes it at what time, under what situations, under what anesthesia. So these are relative and permanent contraindications of a tubectomy.
And doctor, are there any risks associated with tubectomy?
The risk associated with tubectomy is like the risk of any surgery. So just like any surgery comes with anesthesia and anesthesia related risk, so does tubectomy. Also, just like any surgery has the risk of bleeding and infections and wound not healing well, so also does tubectomy have these same risks. Another risk that I would associate with tubectomy is someone who has undergone the procedure and at some point wants to think of reversing the procedure. There could be a regret factor associated with the tubectomy as to why did I do this procedure in the first place. So these are basic risks which are not different from other surgeries.
Doctor, what are the different treatment methods for tubectomy?
Different treatment methods for tubectomy include, as I mentioned earlier, open surgery, that is a mini-lap surgery, where a small cut, that's about a 2 centimeter cut, is taken somewhere on the tummy. Generally, it is either just below the navel if it is done post-delivery, or it is just above your pubic hairline, which is in the bikini line, that is if it is done after the period or after an abortion. So this is a cut which is taken on the tummy. After this, the tube is identified. A particular part of the tube is held with an instrument, and 1 to 2 centimeters of the tube is cut off, and the base of that tube is stitched with a particular suture material, or what we call as a thread. So this blocks the two ends of the tube and makes sure that the ovum or the egg does not reach the uterus. This is open surgery. Apart from this, there is something called as laparoscopic or a keyhole surgery, wherein a small camera goes in through the belly button or just around the belly button. Another small cut is made to ensure that the band applicator or another instrument which is particularly used for a tubal occlusion or a tubectomy surgery goes in, and a silastic band or a small rubber type of a band is applied on a part of the tube. Hence, this tube gets blocked and prevents the entry of the egg into the uterus. Apart from this, there is another method wherein energy source or laser, that is called in common language, can be used, and a part of the tube is either burnt or fulgurated. So these are different methods or different types in which the same surgery called tubectomy can be done. There are different modifications of open surgery and there are different modifications of laparoscopy also, which are out of scope of this topic, but these are the basic types of surgery.
And doctor, which is the best method for tubectomy?
Honestly speaking, I wouldn't rate any method as the best method. It is something that you have to choose. what you think is the best for you. There are many who believe that open surgery is better than laparoscopy. There are many who believe that laparoscopy is better than open surgery. Honestly speaking, both surgeries have the same risks, same benefits, same failure rates, same complication rates. Since open surgery is also done with a very small incision, it is almost at par with laparoscopic surgery as well. So I think there is no one method which is better than the other.
And doctor, what are the precautions to be followed before a tubectomy and why are these precautions essential?
The precautions to be followed before tubectomy are that one, the female has to be relatively sure that she is not pregnant. So if she is pregnant, then this surgery cannot be performed. Secondly, the surgery, if done after the period, has to be done within the first 7 days of the period. If done after an abortion, has to be done within 7 days of an abortion. If it is done after a delivery, then it is either done within the first 7 days, or if the 7-day window is missed, then it has to be done directly after 42 days. So this is one major precaution, that the timing needs to be properly adhered to. Apart from this, one must not be suffering from any infectious diseases, cough, cold, fever, urinary tract infection, a bad GI tract. So these are basic precautions that one has to take before any surgery. So these are the precautions that also need to be taken for a tubectomy surgery. These are important because it will help in the surgery and in the post-operative healing phase also if you are healthy and well. So that is the reason why one needs to take care to follow these precautions. Apart from this, a good hemoglobin, a healthy lifestyle is something that is always welcome.
So it's time for a short break now. We'll all see you in next few minutes. So welcome back to Narikaa Talk Show again. Moving forward to our next question. Doctor, will tubectomy protect against STD?
Well, no, absolutely not. Tubectomy does not protect from sexually transmitted infections. It only prevents the egg from reaching the uterus. For sexually transmitted infections and the care that need to be taken to prevent it, one must be using safe sex practices. Secondly, one should be using barrier methods of contraception, because barriers are the ones which prevent from sexually transmitted infections as well.
Doctor, will the patient still have a period?
Of course, the patient will have a period. The patient will have normal periods just like she had before undergoing the surgery. It does nothing to the femininity of a woman. It does nothing to change how a woman's cycle will be. So women will continue to have periods just like they had before the surgery as well.
And doctor, is it possible to get pregnant after a tubectomy?
Well, as we spoke about the failure rate of tubectomy, less than 1 in 100, that one unfortunate woman may still get pregnant. But then otherwise, pregnancy is not a common thing after a tubectomy surgery. It is almost 100% a successful procedure. But if one wants to actually get pregnant and take effort to get pregnant, then surgeries are available where this blocked tube can be opened and restitched to the other part, and the tube is now recanalized. So this recanalization procedure makes it possible to get pregnant even after the tubectomy.
And doctor, what are the pre-operative tests done before tubectomy?
Before tubectomy, the basic pre-operative tests that are required as per the Government of India norms are a hemoglobin, a basic sugar test, blood group, and a urine test to ensure that there is no urinary infection. Apart from this, there are a lot of hospital protocols or department protocols or anesthetist protocols where the anesthetist who is in charge of giving anesthesia may decide what extra tests are required for a particular woman before she undergoes a tubectomy surgery. So this could include anything like an X-ray of the chest, an ECG, or even a liver or a kidney function test, depending on the situation at that particular point of time. But otherwise, as I mentioned, these three basic tests are more than enough to undergo a tubectomy surgery.
And doctor, what happens during a tubectomy?
During a tubectomy, the woman is under anesthesia. That part of the tube which we intend to block is held under an instrument and is snipped off with a scissor or with a blade, and the base of that particular tube is tied with a thread. So this is what we call as the Pomeroy's, the modified Pomeroy's technique, where we do the tubectomy in a particular procedure, in a particular fashion. In a laparoscopic tubectomy procedure, the band applicator that we spoke about earlier goes inside the tummy, holds or lifts a particular portion of the tube and applies the silastic band on the tube to occlude it and to prevent the egg from reaching the uterus from the ovary.
And doctor, what happens after a tubectomy?
After a tubectomy, a woman immediately becomes permanently sterilized. She needs to take care immediate post-operatively that she does not suffer from any cold, cough or any other specific disease which may hamper her future healing process. Otherwise, a woman is good to do daily activities with immediate effect. Only specific precaution that she needs to take is to avoid lifting very heavy weights for the first 7 days. She goes home by and large the next day. She comes up to the doctor for a follow-up within a week's time to check if everything is okay, the stitches are healed. So she resumes daily activity as soon as possible. So that is the beauty of the surgery, that it can be done so quickly and the woman is recovering so fast.
And doctor, what are the post-surgery suggestions one should follow?
This is very similar to what we took earlier. One should not be lifting very heavy weights. And if sex is something that we need to talk about, then one should avoid sexual activity for the first 1 week at least. And one should prevent falling ill, hence take extra care of your body during those days.
Doctor, can tubectomy operation be undone?
Well, although tubectomy is labeled as an irreversible procedure, advances in science and technology have helped us undo this procedure, or as you put it, can it be undone? Yes, it can. And this surgery is called tubal recanalization. So we enter the tummy either open or through laparoscopic surgery, find the two blocked ends of the tube, freshen them and rejoin them to the other cut end, so the tube becomes as good as new. However, the success of this procedure is something that the surgeon will be able to tell you at the end of the surgery, depending on what length of the tube is remaining or how the tube is currently with regard to the surgery and how much damage has happened because of the previous surgery. So although it can be undone, it is not 100% success guarantee to have another pregnancy, but yes, it definitely can be undone.
And doctor, which doctor should be chosen for recanalization?
Recanalization surgery is something that is taught through residency. So every gynecologist is taught and is capable of performing a recanalization surgery. So gynecologist is someone who does this procedure in the first place. If you want to actually increase your chances of success, then maybe going to someone who has good experience in doing these surgeries or someone who's been doing this surgery regularly, then your chances of having a pregnancy after a tubectomy increase drastically.
And doctor, what are the side effects of tubectomy?
There are no side effects of tubectomy per se. There are many misconceptions that one may increase in their size, one may gain weight, there is bloating, there are irregular periods, but honestly this is not true. There are no actual side effects per se. Normal side effects would probably mean, I'll go back to normal side effects. The normal side effects would probably involve infection at the site of the cut or just a little bit of a malaise or a weakness after the surgery. But that is with any surgery per se, that is not specifically with tubectomy. One resumes activity as soon as possible. People may go to work within 2 to 3 days time and the stitches are generally removed on day 7. So there are no specific side effects associated with tubectomy per se.
complications associated with tubectomy?
The complications associated with tubectomy are those that are associated with any surgery. So, as we took in the previous question as well, so some amount of bleeding, which is more than normal, could be a complication of a tubectomy surgery. Wound infections or not healing of the wound or having some discharge through the wound could be another complication of a tubectomy surgery. Apart from this, individualized risks are something that one needs to consider. So, if someone is undergoing a tubectomy surgery who's already had 2 cesareans or 3 cesareans in the past, we are looking at something called as adhesions, that is, the internal wounds may not have healed and gone back to normal after their previous surgery. So, with higher number of surgeries, the chances of adhesions increase, and with the chances of adhesions, the risk or injury to the surrounding structures like the bladder, the bowel, these are some things that are very specific to a particular patient per se, but these are also associated risks. So these are the major risk factors that are associated with this surgery.
And doctor, what are the benefits and risks of tubectomy?
The benefit of tubectomy is that the family planning onus or the decision to decide how much the family size should be is with the woman herself. So she decides that okay, I have had my babies and this is all that I want, and I can decide to have a permanent form of sterilization. So this is the major benefit that this surgery can provide. With the population explosion happening in the country, this is probably a tool and a way forward where we can actually limit the size of the population, and hence this is an important method in family planning. Risk associated with tubectomy is that one has to be reasonably sure that yes, I decided that this is all I want to have with regard to my family size and it is a permanent procedure. We don't want regrets later on that oh, I could have had one more child, or this is something that a decision I took in haste. So this is the risk that we are probably looking at. There is nothing specific or added risk that we have in this surgery per se.
Alright, thank you doctor for sharing your informative views on it, and I hope this session is really helpful and beneficial to all the lovely viewers out there. So before leaving, doctor, is there anything else that you would like to share with our viewers?
Well, it is a form of sterilization which is permanent. So be reasonably sure before opting for this procedure, because a lot of options are available, right from long-acting contraception to temporary contraception to male sterilization also, frankly speaking. So once you're reasonably sure that okay, I want to have a permanent sterilization, then only go ahead with this procedure. There is reversal of sterilization, which is an option available for women who want to have children even after the sterilization procedure is complete. But as we spoke about earlier, it may not be a 100% successful guarantee to have children in the future. But yes, it is a tool of women empowerment where the woman herself can decide that yes, I need to have a stop on the number of children that I have and I want to limit the size of my family. So this is something that is a way forward in the family planning, especially in a country like ours with the population explosion that we are facing. I would like to thank Narikaa for this opportunity and calling me for this show. Thank you so much.
Well, doctor, that was really a great response, and it means really a lot to us to be with you in the Narikaa Talk Show. And thank you so much for taking your precious time out there. So we'll see you in next session with another exciting topic. Till then, to all the lovely viewers, stay tuned, stay happy, and stay safe.